Hello, I'm Dr. Ravindra. I'm the consultant orthopedic surgeon working here at Columbia Hospital, Whitefield. Joint replacement surgeries are usually done for elderly patients or young patients in whom we have not much options left. The idea behind this is, as has been rightly asked, is that the joints tends to wear with time. Now, there is a bearing surface in the joint which is made up of either plastic and metal or ceramic and ceramic. With we use gradually it tends to wear off. Now, current data available, an average survival of a knee joint is around 15 years, the hip joint is around 15 to 18 years. And of course, there are patients who reap the good benefits of joint replacement for time much beyond than this, but this is just a minimum average that I'm just talking about.